Doki, I agree though.
Greetings, Kunle. Hope all is well. You look worried.
Doki. How I wan tell Titi now? She go think say I don't play away match. But I dey clean.
Kunle, calm down. What are we talking about here? What's the matter?
Doki, I noticed last week say I just dey peace. And after small time, e be like say as I dey peace, e dey pain me small. Na I say make I just enter that small lab wey dey our side. Make I do urine test.
So what did they find, Kunle?
Doki. Dem say I get staphylococcus aureus. Where I forget am.
Kunle, sorry o.
Doki, why you dey laugh me now? The matter no funny.
Sorry, Kunle. I find your confusion and anxiety amusing, especially the way you called that thing that you said they found in your urine. Anyway, if you were to ask me, I'll be more particular about checking your blood sugar and then getting to the root of what looks like a urinary tract infection that you might have.
Keep blood sugar, how now? I dey talk peace, you dey talk blood sugar. And Doki, I no understand though. I tell you say lab test talk say I get staphylococcus aureus. You don't see that one talk about. No be serious infection wey dem talk say person fit get through sex and wey dey cause infertility and all kinds of other problems. I know say Titi no dey cheat on me. I trust her die. And we never born pikin finish o.
Oga Kunle, in this economy, you are still planning to have more kids after 2. I hail you. Anyway, it's obvious that these confused and criminal street vendors marketing all kinds of mixtures and cures have gotten into your head with all this nonsense you are talking. And by the way, it's pronounced Staphylococcus aureus, not Staphylococcus aureus, or whatever it is that they call it.
Doki, I no just dey understand you sometimes. Shey na pronunciation be the problem now? E dey obvious say something dey wey you know wey I no know. Doki, educate me now.
Okay, Kunle. Staphylococcus is a bacteria that can cause all kinds of diseases when it is found in the wrong place. But it might shock you to know that practically all of us have staphylococcus on our skin, living there normally without causing disease.
Doki? All of us get staphylococcus, abi na staphylococcus, wetin you call am? All of us get am for body?
Yes, Kunle, we do. There are bacteria in different parts of the body that are there and are harmless. Only if they get to the wrong place and multiply abnormally can they cause disease.
So all these idiots wey dey road just dey deceive us ni? Staphylococcus, dem go dey sing song every time. So na why dem dey whine us?
Well, Kunle, you didn't hear me say that it can't cause infection. However, the first thing that is important for you to settle in your mind is that as against what those crooks out there would like you to believe, it's not sexually transmitted. And to associate it with causing infertility is something that is not as simple and straightforward and needs to be properly explained.
Okay, Doki, I hear you, but where I take see am now?
Well, Kunle, most times when I see urine test results saying they had a growth of staphylococcus, I take it with a pinch of salt because most times the urine sample was not properly collected and got contaminated with bacteria from the skin.
So I fit no get staphylococcus with that? Oh, well.
Well, Kunle, you need to collect a urine sample properly and have it tested if you are still having symptoms. But by the way, you've still not told me whether your blood sugar was checked and what the result was.
Doki, I no check blood sugar, but wetin sef? You know say I no dey chop sweet things like that. Soft drink, I no dey take. And if no be say you talk say make we no dey drink agbo, na bitter thing I like. I for dey take all those, mixture wey dem go talk say go cleanse yama for your body.
But you drink beer, abi, and sometimes malt too. I laugh in Spanish. Anyway, it's not just about eating or drinking sugary things, though that increases your chances of developing diabetes, especially if it runs in your family.
Doki, this diabetes thing wey you talk now, no be I hear say they make them cut person leg, abi they keep person sef?
Well, yes, Kunle, it can be a very deadly disease, both in children and in adults, and especially in the adult type. Most people do not know they are diabetic until complications develop.
Doki, pikin sef fit get am? I think say na only adults dey get diabetes o.
Well, Kunle, while the type that occurs in children may be slightly different from that which occurs in adults. Both can be very problematic. However, common to both types is a tendency to urinate a whole lot. And as a result, there might also be a need to take a lot of water. However, the slight difference between the two is that in the type that occurs commonly in children, they tend to lose weight, while in the type that occurs in older children and adults, the tendency is that they could be overweight.
Abi na diabetes this my friend pikin get. You know that my friend checks. He tell me say in 7-year-old na so piss the boy just dey piss, and on top the piss na so he dey drink water. And despite all the food wey he dey chop for house, e no dey show for him body. Na so lean the boy dey lean.
Sounds suspicious, I must say. That child should get checked out, because in children with that kind of diabetes, they can have a serious emergency where their blood sugar goes so high and they lose so much of the fluids and electrolytes in their body. And if the situation is not identified quickly and addressed, the child can die.
Doki, this one a serious matter. Once I come off for here, I'll go call Sheks. May sharply go check him pikin blood sugar.
That's fine, Kunle, but you need to check yours. And your friend too needs to check his blood glucose as well. There are a lot of problems people with diabetes can have. It damages the blood vessels and the nerves, such that a person with diabetes may at some point lose the feeling of pain in their feet, and then they can step on a sharp object or hit their leg against something and they don't know, and then they develop a wound which just refuses to heal because germs feed on the excess sugar in their blood. And if things get really bad, the leg begins to die off, and to save the person's life, they may need to cut the leg off.
Now wow. But aside leg wey dem fit cut comot, wetin again fit happen wey dey even keep person wey get diabetes?
Dealing with infections in people with diabetes can be very difficult, and sadly, many people who have diabetes also have, along with it, high blood pressure and high cholesterol. It's a very unholy alliance which can cause a lot of katakata in somebody's life. People with diabetes are also at risk of developing stroke, and also their blood sugar can go very high, which can be dangerous, or in some situations very low, which can be very deadly.
Doki, na wow. Is it treatable, sha?
Well, if diagnosed on time, it can be treated. However, medically, there is no cure. For children with the type that is commoner in children, they may need to be on insulin injections for the rest of their lives. And for adults who have the other type of diabetes, there are certain drugs they may have to take every day to moderate their blood sugar. And at some point, they may also need to start taking insulin injections. Also, for both, there are certain things they need to do to adjust their diet to be safe.
Doki. So na to dey check person blood sugar and blood pressure regularly, make kasala no go burst. Okay, Doki. Na go a day so, make I go better lab, go check my blood sugar and my blood pressure, and make I repeat that urine test. God punish all those staphylococcus guys dem wey dey bus stop, wey dey feed people with nonsense information, plus all this their medicine wey dem dey advertise, wey dey cure all the diseases for this world. I go dey gist you as e dey go, Doki.
Sure, Kunle. I'll be looking forward to hearing from you, Chief Kunle himself, the Olofofo one of Ofofo land. See you soon.